We have very exciting updates we like to share with our community members. We would first kick off our presentation with a presentation on event-based surveillance. This has been a very exciting topic for most of community members who are interested to support integrated disease surveillance and response. So we'll be hearing more from the community event-based surveillance workflows that have been built to support surveillance in Mali. So to start us off, I would ask Hiell to take us through the first part of presentation.
Yes, thank you, Anthony. So today we're gonna talk about the event-based surveillance that we did in Mali. So just to give you a little background of this project. So the Malian government selected the CHT as their electronic community health information system. And this is done a long time ago with Musso, and who is an NGO that is in Mali and has developed has used for a few years now the CHT. So based on this experience, so the government, the MOH, selected the CHT as the national system. So we develop many workflow for the child health, neonatal health, anything about the family planning, and maternity health, immunization, infection disease, and also the stock monitoring. And additionally, we put also the supervision for the CHW so that we can help them in their work. At this moment, we have around 5,000 users, and more than 150K household was registered to this application, and this was deployed in 6 regions. So we are still on the scale-up part. It's still progressing, but we are going there. So yeah, we can move to the next slide. So as part of their workflow, so they wanted to have a single tool for anything related to the health activities. So one of let's say there was the event-based surveillance that we added to the tool that we call Disc Mali. It's the CHT application. So in order to allow the CHW and other local actors to report unusual health events that can happen in the community, and such as cholera, tuberculosis, TB, and measles. So this will allow people to detect quickly, and the CHW to detect and to report quickly, so that at the clinical levels they can act and have a positive response to address this issue. So we're gonna go over it on the next slide. So I will explain you in detail the workflow. Oh, yes, please. Yeah, I forgot about this. Sorry. So we have the SMS part. Like I mentioned, it's the event-based surveillance. So in order to detect quickly, to report quickly any events that happen to the community. So we can use SMS in order to do that. When the CHW report something, maybe it's something really important. So as you know, our tool is offline. It's an offline tool, but we can send SMS to a doctor or somebody who is at the health facility, so that he can act quickly receiving this SMS in order to give the healthcare to the community. So this is why we recommend the use of SMS. And there were three options for that. There was the part without SMS. It's when we use our CHT application. So we don't send any SMS to report. But the second option was the two-way SMS, where as soon as we report something, an SMS is sent at the upper level so that they can start the workflow and act accordingly, and they can respond. And when they respond, it can trigger a task in our system. So this is the two-way SMS option. We have the bulk SMS, which is just to inform in order to have a quick response, but there is no action after the, let's say, action into the system when it is done. So it's a second way. So, and due to many reasons, we went with the option without the SMS, which is the one we are using currently, in order to facilitate the deployment with the CHT, with the CHW, sorry, that are really more familiar with the tool. So it was a cost-effective choice, but we went with that option. So before talking about the workflow, we'll go through the hierarchy of the health system of Mali. So as usual, we have the central level, the top level, the national level, if you can see it like that. And when we go down, we have the regional level and then the district. And on each district, we have a mini health area where you can see the DTC. It's, let's say, a nurse that is at the health area, or a doctor who is at the health area, who can do some research or some diagnostics. We're going to see it later. And then you have the supervisor area, which is the supervisor of the CHW, who manage all the CHW when they report cases or to give them advice. And then you have the CHW site. So each CHW in the community is assigned to a site or to a village. He can have one or two villages depending on where he are. So this is something that is handled by the national level. So on that village, we can have many family and many household. So we're gonna see on the next slide how they can intervene. They are working to detect those, to report any events. So I'm gonna start from the bottom and go to the top. So at the CHW level or other actor in the community, so their main role is to, during their healthcare activity, to detect any report. So they will have a form to fill where they can report the sign, any epidemic case or extraordinary events that happen to the community. Then the supervisor will receive that alert, and he will do some checking, so sort it to make sure that it is really an alert. And then once he confirms that, so the information is sent to the health area, so where the DTC, the nurse, they call it DTC, the nurse, it's at the health area, who can double check and even do some analysis to make sure that everything is okay. He can also do some samples, some tests to validate this alert. And he will work with the district level, because sometimes he doesn't have the tools, or he has to consult the district level for him to help him to investigate this case, or to have some information on how he can address this issue that he noticed in the community. So they work together. So the district will validate everything and give the advice. And the central level also, it's part of this project. But they monitor, they oversee everything, do some analysis, and also give some advice on how they can handle what is happening in the community. So those two levels, the central and the district, don't have anything to do into the application, but it's just they are here to coordinate and to give advice. But it is possible, but in this case, we didn't assign them any action to do, but it is possible. The CHT offered that possibility. So let's move to the next slide. Thank you. Okay, so this is the workflow. I already, let's say, during my previous slide, I mentioned some steps, so you can see it here in details. So at the first level, so the alert notification. So it can be for an individual, a person that we notice that something is not it's not accurate, he has some sign of something, or it can be at the village level. I mean, the locality, we notice something that's, for example, animals, something happened with the animals, or many people. There is something that is happening to many people, so we can say that it's at the village level. So those are two types of alert. So as soon as we receive, we have the alert, automatically the system sends a notification to the supervisor and also the nurse at the health facility. So for them to be aware that something is happening. So as soon as they receive the notification, they are aware. And then at the third level, the supervisor will do some will verify the alert to make sure that the information that was entered by the CHW or the other actor are accurate. And then after he do that, there will be a verification that will be an alert verification form, a task that will trigger automatically at the DTC, I mean at the health facility, in order for him to investigate and to see if something is wrong, or to double check. And as mentioned here, let's say, for example, the supervisor didn't get the notification, or for some reason he is not available. Automatically in the system, after 24 hours, there is a task for the nurse in order for him to do the investigation, the verification, let's say. So this is something that was asked by the Ministry of Health of Mali. So this is what we implement that, but all this is customized. And once at the fifth step, so when they receive a notification, so all the actors are informed about the verification that was done by the nurse. So we sent to the CHW. We send also a message to the supervisor to let him know that the verification was done. And once at the sixth step, the nurse will have a test result form. Let's say he did some investigation and now he have all the results, so that he can, so he will fill a form, and in order to inform the other actors at the step 7 to start about the result and give them some advice on what they can do. So yes, so that is the process. So I'm gonna do a quick demo of that, and if you have any question, feel free to ask. We'll start with the demo. Let me share my screen. Okay. Can you let me know if you can see my screen?
Yeah, we can see it.
Okay, super. So I have a multiple profile here. I'm at, let's say, I will connect to the system. So I'm on my CHT environment. So as a CHW, I have all the village that I deserve. So when I go to one village, to the family, the concession, and the household, so I'm gonna do, let's say, a notification for a person. So I'm gonna select the person, Aisha Diabate. So click on, yes, there is a notification for that person. So I'm gonna click on that. So the question, was it done today? Yes. And who reported it? So I will say the CHW, and it happened on the concession, meaning on the household. Click on next. And so they will ask me what are the warning signs that I found. Let's say there are many cases, and based on events, we can something will happen. So this is customized depending on the national protocol. Let's say that it was diarrhea that happened, that he noticed on this patient, and also some vomiting that he noticed. So he will select sign. He can select many signs as he wants. So I'm going to click, those are the 2 signs that he noticed. And that the patient is ill, and since when, I will say today. Was there any treatment that happened to that patient? Let's say no. And what is the condition? How do you see the patient at this moment? I can say, I don't know. And is there any contact cases that have the same symptom or same warning? We can say, yeah, maybe 2 people. And what are the corrective action that the CHW can take? So there are many proposals, let's say, to intensify the surveillance, that from his recommendation, this is what he suggested. So I will click on next. And if there is any other comment, I can put it here. Well, let's say I don't have any comment. So then I have the summary saying that at this village with the phone number, Aisha, the patient stage is unknown, and the signs are the liquid and vomiting. And based on those two signs, the patient has, the diagnosis is cholera. So this is a disease under surveillance. So we have some special instruction that can be done. And that's it. So I can submit the form, and this is at this moment the patient, the information is sent at the upper level. I just want to do one more notification. This was specific to a patient. So let's say it's happened at the village level. It's exactly the same process to notify the alert. So I'm going to click here, same thing. It's alert notification at the village level. And it was done today as well. And the date that it occurred, it's today, CHW, let's say, no, it's at the village and satellite village. And you're gonna see as well also the signs. Like I said, this is something that touch the village. It's not to one person. So let's say it was a dog aggression that we notice, and also we notice repeated abortion, if I can say it like that, repeated abortion on pigs, on ruminants and pig. So those are the two signs he noticed on the village. How many people, was there any death? Let's say no. Was there any animal death? Let's say yes, there were two people, the two animals that were deceased. And what are the corrective action? It's intensify the surveillance. Next, any comments? No. And as usual, you have the summary, what happened, the signs, and based on those two signs, the suspected diagnosis, it's animal rabies and brucellosis, and it's also a disease under surveillance. So I'm gonna submit it. So the CHW has done his work, and what will happen? We will go to the supervisor level here. So I will connect as a supervisor. Just one. I'm gonna change it a little bit. It says in French. I'm gonna switch it to English. So the supervisor we should receive a task. So I'm just gonna refresh, synchronize, I mean. It is sync now. So as you notice, he received a notification saying that there is an alert sorting at this village, EBS village, and the patient was Aisha Jabate, so he received those two alerts. So it is due today. He can work on it in order to sort it. And I'm just gonna show you at the DTC. DTC, it's at the health area level. It is in French. So just give me a second. We'll disconnect and put it in English. Okay, I'm gonna refresh. I'm gonna sync. Okay, I think it's done. So as you notice, the DTC at the health area also receives some notification. EBS, there is an alert, and he can see all the details. And for the patient, who is Aisha, he will also alert notification for an individual, Aisha Jabate. So he receive all of this information. So I'm gonna go back to the supervisor who will do let's say the sorting. So he will select the task. Okay, so he will give him the information. Do you want to sort the case? Yes, I want. Have you found the notified case? Yes, I did. And do you find the same sign already reported? He can say yes, but have you found any other sign? Here he can specify, let's say, there is another sign that I noticed. He can put it here and select. It's also possible. Maybe he is at the village, and with the CHW, he was there doing a supervision, and he decided to sort it at the same time. So so he can say yes, but in our case, I will say no. Have you recorded any death? Let's say yes, one people. And have you any case of animal? Let's say yes, one people or one animal, let's say. Next. So now we have based on his sorting, did he think that it is okay? He say yes, this case is verified. So let's send it to the upper level so that it can be analyzed. So here you have the symptoms. So the suspected diagnostic by the supervisor. So it's the same. We have all the information that the supervisor had. If he had chosen some other signs, so we will have something here say that there are some other sign and it is okay. So I'm going to submit it. And as soon as I submitted, the task disappear. So I'm going to go back to the health area, health facility. So
Yeah, time
yes,
check. You have 2 minutes to complete.
2 minutes. Okay,
Yeah.
we'll try to go. We'll try. Okay, no, it's not an issue. So I'm going to refresh sync quickly. We are almost done. So here you receive the alert verification. It was not so at the health, yes, at the DTC. So he will verify the alerts, make sure that everything is okay. Have you checked the alert? Yes, it was, let's say, the CSCOM, it's the health area in Mali. So yes, he see the same sign. Any case of disease, let's say no. And have you collect any sample? He can say, yes, I collect some sample today and at this time, and it was a blood sample. And do you want to send the sample to the next level, who can be the district, in order to verify it? Yes, he want. Any suspected case, let's say yes. So the alert is true. So as soon as we have the summary with everything that he has done and his diagnostic. So it's the same as the supervisor and as the CHW. So he will submit it automatically. He will have the test result that he can fill as soon as he have the result. So once he verify the alert and he get the result at his level, if he can do it, or at the upper level, the district, he will fill this form. Meanwhile, if I refresh, the supervisor will receive a notification saying that the verification was done by the DTC, and the supervisor and the CHW as well will receive a task, if I synchronize it, saying that your alert was verified. So he have all the information that was put to the DTC. So and the last part of this demo, it's the test result. It's the same thing. Once he receives the test result, he will just fill the health, the DTC. He will just fill the test result saying that it is positive, and with his observation. Hello, sorry. I'm trying to, and click on next. And do you want to send the result? He will say yes. And what will happen? Everybody will receive the result here. So if I refresh, the supervisor will receive the results. Yes, you see the test result here, the result and some information. Same thing with the CHW. If I do also as well the synchronization, let me do that. And that's it. So this is the end of this workflow. And as I mentioned, so it's really something that can be customized. We can put some information so that any action can be done after receiving the results. You see here, it's the notification to the CHW, letting him know that it is done. Here is the result of what happened about your alert. So yes, it's okay. I'm done. Any question? I was not seeing the screen to see if there was some question, but feel free to let me know if you have any question. It will be a pleasure to answer those questions.
All right. Thanks, Hiell. Any questions from the community? Hiell, quick one. Oh, Josh,
Sorry,
you
I'm
can
just
go.
going to offer a quick comment, just saying thank you, for walking us through all of that, because when you say events-based surveillance, I don't think in my head before I really understood the kind of depth of workflow that you can get, being able to see the data flowing between multiple users at multiple levels of the hierarchy. Really, I think that kind of shows the power of the workflows that you guys have been able to put together. So that was really cool to see. Thank you.
You're welcome. Thank you.
Yeah, thanks, Hiell, and thanks, Josh, for those comments. Hiell, quick one. I've seen from one of the workflows you are able to fill some animal-related events. So do you engage veterinary officers to supporting the verification services, or do we expect medical health officials to supporting the verification?
I would say it depends on what you are looking for. Here, they are more looking for something that can affect the community, because the people can get sick due to that. And this is why it's really about the doctors and not how do you say it? Sorry, veterinarians. But this is something, it can be possible. It's not an issue. We can just add a user that is veterinarian at this level, and they can also contribute to that workflow. It's really open. But the focus was what happened to the community and to people, so that they don't get sick.